This is the injury report presented by NYU Langone Health. Knicks guard Deuce McBride has been balling to start the season, but as you know, he's missing some time on the court for that sprained ankle. Well, NYU Langone sports medicine specialist Dr. Natasha Desai treats patients' chronic joint pain without surgery. Deuce doesn't need surgery, so she's absolutely perfect person to talk about Deuce's injury and why ankle sprains are so common in basketball, especially when it comes to the Knicks. Doc, thanks for hopping on with this right now. We got the video here. You can kind of see him driving in the lane, and then he lands awkwardly on that left ankle on his way down. Can you break down what could have caused the sprain and what's happening to the ankle when it makes impact to the ground?
Yeah, the ankle appears to land planted, and then his ankle kind of falls inward, so his foot goes outwards. That's called an eversion injury. It's actually more typical when you land on a foot or something like that. He does get a little hit by his opponent there, but the typical ankle sprain is when you invert your foot, when the foot rolls inwards, and you get that lateral ankle sprain. That is what the most common type of ankle sprain. This is a little bit more complicated, which is why I think people are a little bit more on edge with this injury, because it appears to be a high ankle sprain or a syndesmotic sprain. So the ankle joint, to give a little anatomy, has the lateral ligaments, which are meant to have a little side-to-side stretch and pull. The syndesmosis ligaments really don't provide a lot of motion. They really stabilize the tibia and the fibula together as the roof of the ankle. And so any kind of sprain or tear of those ligaments really can create instability and be a little bit more complicated of an ankle sprain.
I want to be a syndesmosis ligament because I don't want to do much. I just want to bring everybody together. I'm going to start using that in my everyday vocabulary. So thanks for that, Doc. We saw, or it's been reported that his x-rays were negative and he underwent an MRI exam on Monday. He's been in a walking boot and he missed Tuesday night's win over Toronto. So what's the best case and worst case scenario when doctors are reading the MRI, and what's the best and worst case scenario when it comes to getting him back on the court? The Knicks are thin at guard and Deuce has been balling this season.
Yeah, well, at worst case, I think we could already rule out, right? The worst case is that you tear those syndesmotic ligaments and it tears up into this fibrous connective tissue called the syndesmosis that connects the tibia and the fibula. If that happens, that's pretty much surgical. So thankfully that did not happen. Now, still syndesmosis sprains or high ankle sprains can be quite significant and create instability to the ankle. I think that we may get lucky here because there are some positive signs. Without having seen the MRI myself, the things that I look at is that he's weight bearing in his boot, which it implies that he's able to tolerate that with minimal pain, and there's no instability while he's walking. So that is a good sign, and best case would be a few weeks at minimum. Worst case is that there is some instability or he's very slow to heal because he is doing too much too soon. And that then we're looking more longer term, like a couple of months, unfortunately.
Well, you made a lot of Knicks fans smile just now because they're never lucky when it comes to these injuries. All right, $1 million question here. If you had a patient that's not a pro athlete named Deuce McBride come in with a sprained ankle, would you treat them the same way? I'm talking x-ray, MRI, walking boot, or would you treat them completely differently?
Absolutely, exactly the same management. In a high ankle sprain, we want to make sure the ankle is stable, right? So you're doing x-rays first, ideally with stress views to see if there's any instability between the bones there. And unfortunately, specifically with high ankle sprains, we can't see all the tissues we need to see. So we're more often than not ordering an MRI if that's what we suspect. For regular ankle sprains, like the lateral ankle sprains that I mentioned earlier, we typically don't get an MRI early because it's not really needed. But for high ankle sprains, if they have that plant and eversion, or the plant and twist type of injury, and the pain's more above the ankle, that is when we get concerned, and that's when we're ordering an MRI early.
All right. Thank you, Doc. I didn't know there were so many different types of ankle injuries out there. So thanks for the knowledge.
Of course.
Appreciate you hopping on with us.
Thank you for having me.